What are the implications of KRAS mutations in colon cancer? The KRAS gene is a critical component in the epidermal growth factor receptor, EGFR, signaling pathway. When mutated, KRAS leads to constant activation of this pathway, driving uncontrolled cell growth and division. Specifically, KRAS mutations result in an abnormal form of the KRAS protein that is perpetually active, bypassing the regulatory role of EGFR. Normally, EGFR needs to be activated by a growth factor to set off a chain of signals for cell growth. However, mutated KRAS essentially locks the signaling pathway in an on state, making cells insensitive to the regulatory controls imposed by EGFR. KRAS mutations in colon cancer serve as both a diagnostic marker and a predictor for treatment response. These mutations usually make the cancer cells resistant to EGFR-targeted therapies such as Cetuximab and Panitumumab. Consequently, knowing the KRAS mutation status is essential for treatment planning. KRAS mutations in colon cancer have been found to be associated with poorer survival rates and are often linked with resistance to standard chemotherapy regimens. Several clinical trials are ongoing to find specific inhibitors for KRAS-mutated colon cancer. Colon cancer is the third most common cancer globally, with KRAS mutations accounting for a significant proportion of cases. According to the American Cancer Society, the 5-year survival rate for stage 4 colon cancer is just around 14%, highlighting the urgency in finding effective treatments for KRAS-mutated cases. The KRAS mutation status is usually determined through genetic testing of the tumor tissue. Once confirmed, treatment may involve standard chemotherapy, radiation, or targeted therapies, although the latter are generally less effective in KRAS-mutated cases. Current research is focusing on novel therapies that can specifically target KRAS mutations. Drugs like sotorasib and adagrasib are showing promise in clinical trials for treating various KRAS-mutated cancers, including colon cancer. For a more in-depth understanding, various scientific articles and clinical trials discuss the role of KRAS mutations in colon cancer, diagnostic methods, and emerging treatment options.